Hey everyone, welcome back to the Fertility Confidence Podcast. We took a little semi-intentional hiatus coupled with an unintentional hiatus. I went off and got married in September, and so I took a couple weeks off of recording, and then I came back with no voice for a long time, sick children, all of the things against us, but we are back and hopefully better than ever. And today I have a really fun interview with you. I got to sit down with Dr. Leah Gordon and talk all about male factor fertility. And she was very open with sharing her journey with severe male factor infertility and a lot of really great conversations to have, tools, resources, testing to do, tips and tricks. So if you are either new to the fertility space, this is a good one for you because I think really Dr. Leah does a great job of kind of hammering home how important it is to actually have this conversation sooner rather than later. Ideally, we both agreed that if we could sit down with a couple who is just starting out or not even actively trying yet, the one thing we would ask them to do is a semen analysis just to get a little bit more information from them. So a little bit about Leah. Dr. Leah, she's a licensed naturopathic and functional medicine doctor, and she specializes in supporting women toward their journey to motherhood. So she has a beautiful online platform called Womanhood Wellness, and she provides guidance for women wanting to break up with birth control, balance their hormones, prepare for pregnancy, conceive naturally, or navigate infertility and treatment. She's the founding formulator at Needed, the co-host of a podcast called Healthy as a Mother. She's a course creator, a speaker, and she combines her clinical and personal experience to help empower women and couples overcoming the obstacles of infertility. So Dr. Leah shared some really amazing goodies with us that I'm going to pop in the show notes for you, but she does have a Discover Your Fertility Type quiz over on her website. You can go to www.womanhoodwellness.com/quiz. And you can also head over to thisisneeded.com, and Dr. Leah offered a 20% off coupon for your first order of Needed products using the code Dr. Gordon. So I'll make sure, very, very generous, Dr. Leah, thank you so much. I'll pop that in the show notes for our listeners, and I hope you guys enjoy the episode. Take care. Hello, Dr. Leah. Welcome to the Fertility Confidence Podcast.
Thank you. Thank you so much for having me. I'm excited to be here.
Why don't we start with you sharing with us just a little bit about what got you into naturopathic medicine and specifically into the world of fertility?
Yeah. So I started actually working at an alternative spinal rehab center when I was really young. We had kind of a work share thing in middle school, and that was where I kind of interned. And I loved it so much. They loved me that I started working there in high school. And it really opened up my eyes to an alternative way of healing. The people coming there were kind of alternatives to spinal surgery and all of these other things that they were told by the conventional model. And I learned about nutrition and lifestyle medicine. And it was just really eye-opening. And that was where I learned about naturopathic medicine, was from the people who own that clinic. And so I went down a whole path of kind of identifying what kind of doctor I wanted to be. I knew I wanted to be a doctor. I knew I wanted to solve problems, and I knew I wanted to work with people. My favorite part of being in that clinic was hearing people's stories. Mm-hmm. So naturopathic medicine was just what won. I investigated all sorts of different healing modalities, and that was where my heart was. And then as many of us, we tend to focus on the things that have either impacted us or that we're really passionate about. And for me, women's health was always something I struggled with. There were many facets of it. And that was kind of the beginning of my practice, was focusing on hormones and women's health, until I was about halfway through naturopathic medical school. And we discovered that my husband didn't have any sperm in our sperm analysis class in medical school. And that started our 6-year journey of infertility, trying to figure out why he didn't have sperm, what was going on. And I learned so much along that process, and it was so hard. And being someone going through infertility and being the opposite partner, I mean, I had my own issues in the sense of I would be considered having polycystic ovaries, but not PCOS. Mm-hmm. And I have polyps and fibroids and those kind of things. But I think I would have conceived okay, have a partner with sperm. So There were obstacles for sure, but severe male factor infertility, and in the intensity of male factor infertility that we had, I found there was very little support and very few people who knew a lot about it. And so I've kind of had to become the doctor that I needed along my journey. And now I love sharing that with people.
I love that. Thank you so much for sharing your story. I think male infertility, just as a whole, is not spoken about quite as loudly as female factor infertility. And I even find sometimes in my community, I have to remind myself, like, okay, we need to focus on this a little bit more. We need to have these conversations more. And I'm having more and more women reaching out with male factor, can you even help with that? Because it's so not well spoken about in the field. So why do you think that is? This is a conversation I have with my team a lot. Like when we go through how can we support our male clients better, and how can we get them more resources through your journey? Do you feel like there's a reason behind why we don't talk about male factor as much as female?
There's so many reasons that I've identified. Many of them, some of them are systemic reasons, I believe, in the sense that, just traditionally, I look back on my husband's grandparents and they struggled to conceive for a while. And finding out about my husband's sperm and knowing there was some genetic component to his, I always thought they never, ever thought to think that his grandpa was a factor at all. It was always blamed on his grandmother, even though they could never find anything wrong with her. And that was back in the 50s. And so there's a systemic issue of, there was more of a patriarchal foundation in the medical system over the last century or so, where men would never take blame, right, for that, or think that there was an issue with them. So there's part of that. There's a part of it that inherently, I think our society and culture just thinks of fertility and pregnancy as a female thing because we are the ones that actually carry the baby and are pregnant. And so there's so much conversation about, oh, the woman is pregnant now. She took a positive pregnancy test. She is now growing the baby. She's birthing the baby. And so I don't think that we think about the important role of the man in that. And then there's a lot of shame around having sperm issues or fertility issues in men. Men traditionally don't go to doctors very often unless they're in pain or they have some other really extreme situation going on. And infertility, unfortunately, can be very silent. Men don't know that they have it. And it's just not something men want to talk about. Even in our journey, my husband's so open. And the reason I've been able to be so open about male factor is he's so cool with it. Yeah. But I have so many clients and people who still haven't told even the people close to them that they're struggling with male factor infertility. And it's unfortunate because couples don't get the support they need. Men don't get the support they need because there's so much shame and they're so quiet about it. So there's even more factors on top of that, but I would say those are kind of the key ones that it's just very lacking and misunderstood. And the rates of male factor infertility are rising so quickly and so rapidly that medical education and support is not keeping up with that increase. Yeah. So a lot of the not the OB-GYNs, but the male reproductive urologists that we saw along our journey, and they're in their 50s, 60s, the male infertility situation was not what it is today back then when they were going through school. So unless they have this personal experience with it or this newfound knowledge to go explore it, they might not really have the tools to support.
Right. Yeah, I totally agree. I find still in my practice and in Fertility Confidence Method, I'm having couples come. Women will be going through all the testing and they'll potentially find, maybe something, maybe not, but they'll have gone through a good 18 months of their journey and they still don't have just even a semen analysis. Like, guys, even though we've found potentially like an ovulatory issue that perhaps that is the reason, or a fibroid or something, and perhaps that is part of the puzzle. We can't just assume everything's okay on the other end. I think I've had this conversation like 3 times just this week with new clients. Like, we don't want to waste time. Like,
No.
yes, we're going to help you with this, but God forbid in 6 months, we do finally like push your partner for a semen analysis. There is male factor, mild, moderate, severe, and we've wasted time that we could have actually done it. And oftentimes it's a bit of the medical system, not advocating for that. And then it could potentially also be part of the partner just not being ready in doing that testing. And I find that's a big piece still with some of our couples as well. And so giving them the information, the time and space, but also showing them the importance. And I think the more we have these conversations, the easier it will be for partners to get the testing done and at least ask for it.
Yeah, no. There are two obstacles in that. Insurance doesn't cover semen analysis until you've been trying for a year. So you have to pay out of pocket. And, for the average American, I think it's hard to convince people to pay cash for their health. But we know as naturopathic doctors that sometimes that's the only way to actually get the information that you need. And it's the one thing that I want to scream at the top of my lungs, which is the minute you have an inkling in your eye that you want a family, get a semen analysis.
Right.
Like seriously, even before testing the female, I believe, because it takes so long to change sperm parameters. Like any shift, any new supplement, any new lifestyle thing, you have to wait like almost 3 months to see if it did anything. And that can be really long. And if you do it and everything's good, that's so awesome. What a relief. And if it's not, you just have more time on your hands. So yeah, my dream would be everyone who, gets coupled or gets married, just like is gifted a semen analysis and a hormone panel for their female, because it would just change everything. And I just see the heartbreak that happens with that. So yeah, I'm very passionate about that.
I feel like there's like budding business in that statement with like a beautifully branded like wedding gift that is a package of like an at-home essay and like a female panel.
Yes, totally. I think that's
together.
The best gift.
I can get behind that for sure. I totally agree. And oftentimes in the early days before I was really focused in infertility and I was seeing a lot more just generic women's health. And I would be working with someone and they'd be like, oh, we're thinking about trying to get pregnant. Like, is there anything you would recommend? And I would say the same thing. Like, if you can get your husband on board to just do a semen analysis now, like, let's do it. It's not that expensive. I'm in Ontario, so things are different, but same struggles in terms of we're used to our free healthcare. So getting people to pay out of pocket is often tricky, but it's like $100 here. Like, let's just get the information and then we'll know where to go from here and ahead of time, which is great.
I love that.
What are some risk factors that you kind of look for when you're talking to a couple doing an intake that would stand out to you as potentially being sperm impactful?
Yeah. Well, I mean, first, which isn't as common, but is definitely any family history, right? If Uncle Joe or anybody in the family had a hard time, because there are some genetic components to fertility stuff. Obvious risk factors in lifestyle would be diet. If someone has that standard American type diet, eating lots of processed food, lots of sugar, lots of alcohol, lots of processed meats, that kind of sets a red flag off in my mind. Toxin exposure is honestly probably one of my biggest red flags. And it's really tricky because there's toxins everywhere. And how do you know if someone has more toxin exposure than others? It really comes down to how well we can detox and our exposures. So someone might not even be that exposed to things. Not everybody needs to work in laying asphalt or work in, a toxin plant or have, be a painter or any of these jobs that we kind of think of as naturally bringing a lot of chemicals. It could just be living day-to-day life, putting on normal deodorant, using cologne, being exposed to plastic. If you don't detox well, then you can have a toxic buildup just as much. But I definitely assess toxin exposure, not only in the environment that they're in and the products that they use and also their profession. And I typically ask what their parents did. Where they grew up and what their parents did, especially what their mom did, what her health was like when they were pregnant. Did she smoke? Did she do drugs? Was she like the classic spray perfume, use tons of conventional products? Because we know that phthalates, which are what is the chemical often found in fragrance products, things like perfumes, colognes, all of the scented products that we have in utero, can impact the male reproduction development. So that man who's coming to me now in his 30s, he could have had a reproductive development issue when he was a baby and never know it because of maybe what his mother was exposed to. So those are kind of the background things I'm looking at. His lifestyle in the sense of, are you a sauna person? Are you, a cyclist? Are you a hockey player? Do you have a lot of injury to your testicles? Have you been a fighter or in the military? These kind of things are kind of red flags as to if there's an issue. And then symptoms that tell me that there could be a problem with testosterone. Things like not having a libido, not ever having a morning erection, having fatigue or low drive in general. If they're super stressed out and they just want to come home and veg and watch TV and they really don't have a lot of interest in sex as much as you think that they should, that's a huge red flag to me that we need to check testosterone. And if testosterone is struggling, most likely sperm is too.
Yeah, completely. I always giggle when I ask, like any scrotal injuries when I'm with a male patient and they kind of look at me like, what do you mean? I'm like,
I know.
The odd like kick, probably not a big problem, but like, did you have to go to the hospital or like any urine blood in your urine ever after like, a sporting event? And you can see them kind of like racking their brain of all the times that they might have thought like, I have an injury and maybe don't know it.
I had a
It's
client
so
recently who's military and he's like, oh my God, the amount of just trauma and injury he's been through. And, he has a lot of sperm issues. And so it's something a lot of men don't think about because I think they just like, oh, that's part of being a man, and also STD history, right? STD history and urinary frequency, signs that there's like a low level UTI, that there can be bacteria in the semen that shouldn't be there that can cause issues with sperm morphology. So there's a lot to look at. Honestly, I honestly love it. And, for me, it's simple. Like to me, male fertility is simple in certain ways, but it's probably because I've been studying it for, almost a decade.
Yeah. I think the great part that I love explaining to my clients when they get, worked up or worried when we're finding male factors, I'm like, you know what? I kind of would rather find this because we have an abundance of research. It's really simple to actually do randomized controlled trials and check for semen parameters versus with female factor infertility when we're really relying on IVF data and that's kind of it. And it's hard to control and the studies are small. Whereas with men, it's a lot simpler to do the research. So we have more. And that usually I find makes people feel a little bit better. It doesn't necessarily make it easier for everybody, but we have a lot of options. And that's always a bit of fresh air, I think, in the infertility space as a whole.
Yeah.
What are some questions that men should be considering maybe asking their doctor, for partners who do want to be really proactive in this space and are really involved and are open to having that conversation? Are there certain things you would recommend that they brought to their primary care doctor or that they vocalized it at a fertility appointment?
Yeah, absolutely. First and foremost is that semen analysis. It's so crucial to understand where we're at. If there's an issue in the semen analysis, low count, low morphology, which is the shape of sperm, low motility, which is how they swim, then we need to figure out what's going on with that. Common thing, this happens in male and female, is that anatomical issues are not ruled out as soon as they should be. So with men, things like a varicocele, which is dilation of the veins, is very common, especially if the man has been a weightlifter or has done any sort of really intense physical activity, especially as a teenager. This can increase your risk of varicoceles, which can drop count and quality of sperm. So just check for them, have your doctor rule that out. Do a simple hormone panel looking at FSH, LH, testosterone to just see if there's an issue coming from the brain or is it coming from the testicles, because those are very different. If there's a severe issue, doing the genetic testing to rule out things like chromosomal issues, X factor, Y factor issues, cystic fibrosis, like these are some of the genetic contributors that can cause issues. And I've had patients, and myself included, we've gone down many rabbit holes and weren't properly worked up for some of these things.
Yeah.
And then on a more functional level, understanding how well am I detoxing, looking at methylation factors like homocysteine. Homocysteine is a marker that, if elevated, tells us either you have a lot of toxin exposure in your body, or you don't have a lot of methylation support, or you genetically don't methylate well. And methylation is a big part of building protein and building DNA in a sperm, and also detoxing. So we see high homocysteine in men with infertility a lot. And other markers, looking at your lipids and your cardiovascular health. And these things all matter because sperm health and fertility health is a side effect of optimal health. If there's something going on in the body, then that points to an issue. So as far as asking your doctor, I would say those are the key things. And then the things you want to ask yourself is, how is your life? How's your lifestyle, and things that the doctor is probably not going to talk to you about as much, but are just as important.
Yeah, that's amazing. I would love to know your thoughts and professional opinions on doing a DNA fragmentation test.
Yeah, I love data. So anytime someone has the financial means, it just gives us more information. A DNA fragmentation test is looking at the integrity of the DNA of sperm. Sometimes men can have normal count and normal morphology motility, but abnormal DNA fragmentation that can be impacting conception. So it depends. I always gauge with my clients, where they're at financially. If they're ready to just go all in, I say, let's get the data and just see. If they have to be more pick and choosy about their labs, then I say, well, let's start with the semen analysis. And if everything looks normal and they've been trying for a long time and there's no other female factor or anything like that, then I would say consider running it. If there's something like, for me, if there's a poor morphology, I kind of already assume there's a DNA issue. So I don't make people run it in that situation. So it just depends. It's not one that I'm like, yes, every single person must do it. It kind of depends on the situation. But my husband did them, right? Like if you're someone who's like, I need to figure this out, I think it can be helpful.
Yeah, agreed. Yeah, they're expensive here too. So it is something that we often have to make decisions around, I think, in terms of resources. Like, is this the best use of resources, or are we already, loading you with antioxidants and likely doing the best job that we can in terms of treatment? So will this actually give us more information to change the treatment plan? And that's kind of where we make our decisions over here, because it is a tough one, I find, for some people.
Yeah, I agree.
Okay, let's get into what everybody wants to know, and that is the tips for improving sperm health. What are some of your top favorite suggestions for clients when they're struggling with poor semen analysis?
Yeah, it really starts. So I'm so root cause based, right? So I'm a fan of getting to the root cause of what's causing the issue as much as possible. And that typically does involve, either a thorough history or labs. For example, is the person struggling with testosterone? Is low testosterone why they have a sperm issue? And why do you have low testosterone? Is it because you're super stressed, because your work is like killing you and you're sleeping 5 hours a day and, not really nourishing yourself and taking care of yourself? We make growth hormone and testosterone production at night. Sleep is so important. So the foundation, I would say, making sure that sleep is first and foremost a priority for both partners, working on sleep hygiene, making sure you're going to bed earlier, getting at least 7 to 9 hours of sleep is key. And if you need support with that, so be it. But again, if you can't sleep well, I look deeper into the root cause of that. Stress, again, is another huge killer of testosterone. So really doing an honest evaluation of your life. And for some people, I'll just give an example. When my husband and I were living in California, and it was hard to make ends meet. California is very expensive. My husband was stressed all the time. He didn't necessarily feel safe in that state much anymore. And he was on edge all the time. And we made a radical decision to move to another state. And it, dropped our income needs significantly. We just feel like our nervous system is calmer. And so sometimes it's not just meditating more and doing yoga, and like those things can help, but sometimes you need to radically change your life.
Yeah,
Change
totally.
your job, change where you live, maybe distance yourself from a toxic relationship, whatever the thing is for you, getting to the root of that. And then nutrition is the next foundation. When sperm are little blobs of DNA, and we need to have certain nutrients to build the sperm. So we have to have key micronutrients, key macronutrients, and we don't want things that negatively impact the DNA. And food is information. And a big part of the foods that we eat give us the stuff we need. And we can choose to eat certain foods that don't bring in inflammatory or oxidative damage. So for example, I'm sure people are just so annoyed hearing this, but eating whole foods, you need to eat fruits and vegetables, good quality meat. So meat is a really controversial thing, and I don't know where you stand on that, but I am a huge fan of animal products in the fertility space, but they need to be high quality. So, going and having a hot dog at a gas station is very different than having a grass-fed steak.
That like literally made my stomach turn.
I know.
That is like the one thing that
I know. I like go there sometimes and I see him like rotating on the spigot. I'm like, how long has that even been there? Like, this is so crazy. So meat is not created equal. And I would say traditionally, at least in the clients I work with, men do eat a lot of meat, and I'm okay with that. However, the quality has to be better. And unfortunately, that often comes with a higher price tag, but this is a place where I think it's important to allocate resources, is high quality food. The data is very clear that processed meats like hot dogs, processed deli meats, these kind of things negatively impact sperm. So get those out of your life, get high quality animal products, as many fruits and vegetables as you can possibly eat, because we need the antioxidants. So I'm also not a fan of the carnivore diet. I'm not a fan of vegan diet. I'm not a fan of carnivore. I think anything that is too extreme, you're missing key parts of the medicine that food brings.
Yeah.
And antioxidants are so important, and those mostly come from fruits and vegetables. So again, eating organic as much as possible, because the herbicides and pesticides on non-organic foods negatively impact sperm. And, whole foods just mean real foods that come from the earth, that grow on a tree in the ground, that eat what comes from the earth. It's not made in a package. You can't pick potato chips. Well, I mean, potato chips aren't as processed as like, Twinkies. There is no Twinkie tree, right? You don't go pick Twinkies out of the earth. So just as much as you can, eating whole foods is really important. And that's the foundation of that. Exercise, finding a happy medium. This is again the same with female fertility. My male patients that wake up at 5 a.m. and run 20 miles, I don't think that's better than not moving at all, right? We have to find a happy medium of moving your body, but not too much. Sperm have to have a lower temperature to survive. Why we were designed that way, I have no idea. It just is how it is. So being mindful of compression shorts, cycling, doing any sort of sport that heats up the scrotum will definitely impact sperm. So just being mindful of that, being mindful of not sauning or hot tubbing in the time, the 3 months before you want to conceive, and any time while you are trying to conceive, we just want to take a break from that. And then, I am a fan, food is first, but supplements are very helpful in the fertility space. And I think men especially, feel really empowered when they feel like they have something they can take that helps them. Yeah. Diet can feel kind of ambiguous, and it's like, well, how many antioxidants did I get today? And so I am a fan of supplements. Needed in particular is a supplement brand that I have helped formulate some sperm products, because there aren't a ton of great options out there. But just bringing in, with food, we have a couple components of how we can supplement to help men. One is antioxidants. So getting even more antioxidants like ALA and NAC and glutathione, CoQ10, these are all very helpful. We want to support a man's microbiome, so the good bacteria that he has. We can do that with diet by eating fermented foods, sauerkrauts, kimchis, that kind of thing. I also often recommend a probiotic. So Needed has a sperm support that I help design, which is a blend of antioxidants and probiotics, which is awesome. And then just making sure there's like an insurance policy on getting the proper vitamins and minerals, right? We need enough B12, B6, folate. We need magnesium and vitamin C and all the different vitamins and minerals to build sperm. So again, food is first, but for my male patients, I typically recommend they're on a high quality multivitamin mineral. Like I said, there's many out there, but I like Neededs. There's a few other brands too that are good. So antioxidants, good multivitamin, mineral, probiotic, and then omega-3s, omega-3 fats. So from food, that looks like wild caught fish, grass-fed beef. For someone who's not a huge fish eater, you might want to supplement with that as well. So that's kind of my core foundation. And if you had to just pick one antioxidant, I would say it's CoQ10.
Mm-hmm. Mm-hmm. Yeah.
Yeah.
Amazing. And I love that you preface like food is first. We always are saying that like our supplements should be an adjunctive tool to our diet and lifestyle, not the first like route of action.
Correct.
And I also love what you said that men sometimes like having that little extra thing. And I think it helps them feel involved, especially when their, partner is taking a ton of things and doing all this extra stuff and they feel a little bit like, they're not actually doing a whole heck of a lot. And so getting them more involved with the diet and lifestyle pieces, but using the supplements as well as kind of a collaborative approach, I think helps to really bond that partnership piece through the infertility aspect as well.
Yeah. And then the last piece I want to mention is mitochondrial support. So we talk a lot about mitochondria with women's egg health, but men's sperm have mitochondria as well. These are the energy powerhouses of the cells. A lot of the things I already mentioned help support the mitochondria, but you can do subtle things like hot, cold showers. Again, you don't want too hot. You don't want to sit in hot, but alternating hot, cold showers at the end of a shower can help with mitochondrial support. All of the pieces that we've already talked about, some other key nutrients like L-carnitine, CoQ10 again is another one. So just boosting the mitochondria as well can really help. And then my last recommendation, even though there's so many we could talk about, is being very mindful of your toxin exposure, getting the toxic products out of your life, checking your personal care products, checking the furniture, the things you paint the walls in your house with. There's so many amazing options now. There was a time when it was harder to maybe be low tox and non-toxic. You'd have to actively seek it out, though. It's not going to be the default that's at your normal grocery store or a typical situation. And I have resources too on my website. I'm sure you do as well, of some of my favorite products for just changing stuff up. The Environmental Working Group is a great resource. I would say that is a huge priority and should be one of the top priorities for male fertility. And the cool thing is, because sperm are made every 72 days or so, every 3 months roughly, you can make really powerful changes by just making a few shifts in your life, getting plastic water bottles out, getting rid of cologne, changing up your deodorant, your shampoo, conditioner. These can make huge changes really quickly, which is cool.
Yeah. I'm of the mind that this crazy decline that we are seeing in male fertility has a lot to do with environment and just exposure and
100%.
all of the things. And like you said, not just through us, but through our parents and our grandparents as well, and the lineage that brings. So I think this is something we're definitely hearing more about in the fertility space, but at least I still not hearing a huge conversation in conventional medicine with toxin exposure. And I'm hoping we'll start to really see that more and more, because the literature is there.
It's very clear.
The projections are scary. So the more we can understand why is this happening and how can we slow down the decline in male fertility, especially as people of reproductive age, trying to grow a family and potentially having sons. Like, these are things we also need to be actually thinking about for them, not just for our ability to conceive right now. That makes it larger, I think, in terms of scale of importance.
Yeah. And it impacts our female babies too. There's a lot of attention put on phthalates in males, but we are now finding in the literature that PCOS might be impacted by toxin exposure in utero for females. They are endocrine disrupting chemicals, meaning they disrupt your hormones, meaning they disrupt that very delicate balance of when your body is deciding if you're a female or a male, of whether you're going to grow a penis or not, whether you're going to have gametes or not, like eggs and sperm. And so these really impact the reason we don't take hormones when we're pregnant is for this exact reason, yet we're exposed to things that act like hormones in our environment all the time. So I think once people start to understand that, it really clicks. But it's like learning a whole new way of living to understand, but it's totally possible and doable. And there's lots of resources.
It's a lot easier now to swap out products and remain in a modest budget than 10 years ago. Cause like I remember trying to swap out all of my makeup and hair care, in my early 20s and not having a lot of options and being a starving student, being like, I can't buy a bottle of shampoo that's this big for $60 and then have it not really work very well. And now we have a plethora of products that work, that still do what they claim to do, that can still, give you anti-aging benefits and help your skin and help your hair, but are clean. And we just didn't really have that option 10 years ago, or we did, but it was really expensive. It's still going to cost more, but we have a lot more options in the market that I think it's helped bring different price points in terms of toxic free living options. So
absolutely. And something as simple as, cleaning products are probably one of the biggest hitters of chemicals, and something like vinegar and baking soda and water. That's all you need to really clean. If you want something more extreme, like there's things like Branch Basics and, there's other options if you need an actual product, but you don't in many situations. So it doesn't have to break the bank. And I think it's just getting out of the cultural expectation that we need a product for every single thing and that we need the most intense, some people look at me, they're like, wait, I can't bleach the bathroom. I'm like, you are going to be fine. I've never bleached my bathroom. I am very healthy. You are fine. We do not need to bleach everything.
I think my one piece of advice for everybody coming out of this conversation is if you still have like an air freshener in your car or one of those Febreze plugins in like every room of your house, or you have a lot of candles that are always lit, those are the things. Like fragrance is probably one of the biggest offenders. And and we're not just talking for sperm health, like we could have a whole conversation around the female factor piece here. So if that's one change that you make this week, that's an impactful change to not be breathing that in anymore. And there's other ways you can use essential oils to get nice scents in your home, but you don't need to smell like that for things to be like clean. And it's just a bit of a perception shift. And it's probably because that's what your mom's house smelled like, right?
Yeah, exactly. People are like, oh, this smells like clean laundry. I'm like, it literally smells like a toxic like chemical plant. I don't know where you are thinking that smells like clean laundry. And there are better brands, right? There are like some candle companies that are making better products. Anything that you can imagine that you want, there really is an alternative for it. You just have to look for it. And there are amazing people on Instagram and all sorts of places where you can find stuff. And like I said, I have resources for people. So don't feel like you're alone in this. Everyone's trying to navigate it. And the pressure will change the industry. It already has to some degree. So just keep on keeping on, and the world will get hopefully less and less toxic.
Yeah, agreed. Okay, Dr. Leah, this was an amazing conversation that took like a bit of a back turn there at the end, but I think a really important topic and EDCs. We could probably talk about that for another hour. But what is one piece of advice that you would love to leave for a couple that is listening and is struggling, particularly with male factor and fertility right now?
Yeah, there's so much that I would say, but I think the biggest piece of advice is to not lose each other in the process. I know what it's like to go through infertility. I know what it's like to go through male factor infertility, and it's no one's fault, and you're in it together. And I encourage you to continue to prioritize time together outside of this constant drive and need to conceive. And remember why you love each other. Remember why you're together. Because if your foundation of your relationship is strong, you can get through anything. I truly believe that. I'm a testament to that. And infertility is hard. Fertility struggles are hard, and it brings up a lot of stuff. Independently go work on your stuff, work on your shadows, seek help, therapists, counselors, whatever, because that work I think is so important so that you come out on the other side stronger instead of broken.
Yeah, I think that's some really powerful advice for everybody in the infertility space. So thank you for sharing that. How can people find more information about you?
Yeah, so I'm on Instagram at Dr. Leah Gordon. You can go to my website, womanhoodwellness.com. I have a free fertility quiz at womanhoodwellness.com/quiz. And if you want to check out any of the needed products, which, like I said, I helped formulate, you can head to thisisneeded.com and use code Dr. Gordon to save some money.
Amazing. I'll make sure all of that is linked in the show notes. This was a wonderful conversation, so I hope we can do it again sometime.
Awesome. Thank you.
Thank you.